That's it. Pelvis towards me, but then your whole body goes back. Ooh. Yeah, open up the chest. Open it up. Yep. That's it. You okay?
I'm great.
Oh. And then you're gonna look up for me. Yeah. Oh, is that as far as we go? Oh. You can relax your head if you want. Just whatever feels comfortable.
Mm-hmm.
Head back. Look back. That's it. Elbow, push. You see how hard you have to like
Oh, yeah.
push. You got some thick joints. Yeah.
There it is.
Yeah, you
Okay.
have to like, So go ahead and tell me then what your chief complaint is, if you have any.
Well, I would say my chief complaint would be I'd gone to an orthopedist, and he had told me I had an acetabular impingement in my right hip. So
Okay.
I have nothing for inward rotation, and so my hip flexor is massive compared to this side. It's really bad.
Let me see what you're talking about. Show me what you mean.
So I guess if you were to see or feel, this one's huge.
Okay, I will.
This, the top of my thighs won't really flatten, so when I stand, I think it's hard for me to stand straight. I can't squat all the way.
Let me see.
And that's painful.
I'm gonna just look at you first, and then I'm gonna go in and feel.
Okay.
I just need to have like a baseline where we are.
But yeah, I can't do a traditional flat-footed squat.
Let
I
me
wish I
just-
could, but when I come down, I can feel it so tight right here. It feels pinching, and if I flatten it out, I can't sit.
Flatten your feet, you mean?
No, I can't flatten my feet. This is about as close
Far
as I
it
get.
goes. Okay. So just go ahead and raise your right leg up as far as you can. Does that hurt at all?
It's tight in the shins.
And the right here?
Mm-hmm.
Interesting. Okay, go back down. And the other leg for me. Is that the same tightness?
More my hamstrings.
More in the hamstrings. Okay. That's usually where we feel it. Yeah, back to the side. Any pain when you do that?
Yeah.
Where?
Groin.
Groin? Same thing again? In the groin?
More in the hip. Just
In
from
the hip.
extending.
Okay. Yep. Any pain when you do that?
Tightness.
Right there on the outside?
Mhm.
Okay, and then this one?
Just tightness.
Same place?
Same place. Yes.
Okay. Now what I'm going to have you do is you're going to go on your stomach. This is the only one we'll have you do on your stomach. And then you're going to lift this leg back as far as you can. Any pain when you do that?
No.
And then the other one? Any pain there?
No pain, just tightness.
Okay, on your back again. Right, any pain when I do this?
Not in that position.
Not when we, but on the upswing it was, right?
Yeah, it's the closer my knee gets to my chest.
How about here?
No.
Okay, your hip socket is okay.
That's good.
You know what I mean? The hip, in guys especially, they lose their hips by the time they're in their 60s, 70s. How about here? Any pain?
Mm-mm.
Okay, so you're not really having too much pain in what we call the acetabulum,
Mm-hmm.
where's the hip, the ball and socket. Any pain here when I do this?
No.
So this is truly ligamentous, soft tissue, muscular. Okay. Pull your knee to your chest for me. I'm going to resist you.
Mm-hmm.
Go ahead, more. It hurts too much?
Yeah.
Okay, go ahead, relax. Where? Point.
The top right
Top
here.
there. Okay. We're going to do the same thing other side. You don't have to, I have to figure this out, okay?
It's more of
Sorry.
a cramp.
A
Like if I were to
cramp.
do it really hard, it would cramp and get real tight.
Okay. Okay. And then the same thing, pull. Any pain there? Not as much.
Mm-mm.
Okay. All right. Okay, I'm going to pull just to there, okay? I'm going to go right into this hip flexor here. I'm going to push right here.
Mm-hmm.
Is that real sore?
No.
Okay, relax. Have you had any physical therapy done?
The orthopedist sent me to physical therapy, but it was more a take home.
Okay. Are you okay with this?
Yes.
I'm going to start stretching the hip flexor, okay?
Sounds good.
See what we got. First we check the bones. Check. Bones are okay. check the soft tissue, okay? Soft tissue, you can repair that a lot easier than a bone. So I don't fiddle with things until I know. This is hard manual labor here. Grab you underneath again. I'm gonna pull you down. Grab on another piece of it. Okay. How about now?
It does. I can feel the range of motion probably getting a little larger.
Yeah.
There it feels like it's a little bit cramped.
Right. So we went from here to here. About 20 degrees.
That's good.
Okay. So you're capable of it. So I want to suggest things like yoga, okay, and maybe stretching. Because if it was something permanent, then it wouldn't matter how much we do this. Because I've worked on some people where the scar tissue is so thick, there's no change with something simple like that. This is a change, a noticeable change.
That's good.
Sometimes we can stretch the back. Sometimes we can recruit other muscles. Okay. Here we go. This might make you cough a little bit, sorry. I'm going to turn you. Oh, it's tight. I'm going to grease your hair up a little bit, sorry.
That's okay.
Like, I grease up everybody in here. Oh, I slide. Side. Relax your head. I've got you. Just relax. Pretty good. That feels pretty good. Alright, let's adjust it. Chin back for me. Yeah, that's pretty good. Chin back. Nice. There we go. How's it feel letting somebody else do that?
Real nice.
It feels pretty good.
Oh yes. Yeah, even when I did see the other chiropractor, I just love getting my bones popped.
I know, it's like that.
Yeah, that's why I gotta keep myself from doing it.
Yeah. I'm pretty good at doing this stuff. Oh my. And here we go. I know, owie. Is that going to hurt too much to do it this way?
No, it's fine.
Is that okay? Alright.
Yeah, I can, if I'm standing and go in the right position, I can make a loud pop with the hips.
Oh, well that was the knee. I'm trying to get the knee here.
Okay.
Let's see, right there. Now we'll do the hips. Reach overhead and grab the tape for me. Relax the hip for me. see where you're feeling tension. Deep breath in. All the way out. You want to go into the glutes?
Mm-hmm.
The back side here.
Oh yeah, I can feel it there.
Well, this is a good hip too.
Yeah, feels nice.
We gotta get him. Get the glutes. I'm gonna work on this, okay, with my elbow a little bit.
Mm-hmm.
You okay with that?
Oh yes.
All right, some people are real touchy about getting worked on here, so I ask.
Yes, I understand.
Okay, so just ask. You'll learn to ask and ask again. Are you sure? Are you okay? Oh my. Okay. Okay. I found it. Okay. Okay. I get it now.
Okay.
I'm sorry. I'm just like, it's gonna be okay. Oh. You know, when I found it, I'm like, yeah! Like, now it makes more sense. Look at that. Oh. Okay. Okay, down to the calf, all right?
Mm-hmm.
Now stretch your calf. Elbow right here, all right?
Mm-hmm.
When did you say this started again?
Oh man, I probably didn't feel it till I was 15 years old.
15, okay.
Yeah. About when I stopped growing, I guess.
The spine stops growing at about 15.
Yeah.
That's why I don't think Diego's gonna grow that much more. He's let the legs grow a little more. How much would you say you grew between 15 and 17?
Oh, you mean his torso?
Yeah, his torso ain't gonna get any bigger. Do you remember?
Oh, me? Yeah, I probably... Oh, nah, I didn't grow too much. Maybe an inch or two.
Yeah, it's always gonna grow.
Yeah.
Your chest gets bigger. You get more muscles, but.
Yeah, that's just about it for me. When I was 6 foot by 14.
Yeah, my son's like 5'8". He's 15. I'm like, I don't think you're gonna grow too much more, Diego. He's like, no, I must be taller. I'm like, I don't think so. Sorry. But it seems like with a lot of you taller guys, the spine tends to wind in here. Yeah. It is what it is. You guys look down a lot. Most people are shorter than you. Okay. So. And then when you go to look up, your body's like, well, I'm not used to that. So it recruits the wrong muscles.
Yeah.
That's what I find on people.
Definitely noticing that.
Normal. You want to show the work or no?
I don't know.
I don't know either. I think so. I think we could show this. I'm not showing much. I'm just showing the side of his hip.
I thought what the majority of it was, if this was educational, it's sort of...
They said it didn't matter.
Really?
They said it didn't matter. That they would restrict it.
Oof.
Yeah, they're pretty brutal. You got a little bit of me doing it, right?
Yeah.
They can't handle me doing this for too much. They skip off in about a minute. They're like, okay, she's massaging the same spot over and over again.
I should probably also mention that it's taken a toll on my oblique on the right side. So I almost have no oblique.
You mean over here?
Yes.
Yeah. It's alright.
That
Look, it's right there. You feel that?
Oh, yeah.
That. I'm warming up to it, okay?
No, it feels nice, though.
I'm just
I have
trying.
no complaints.
I'm just trying to get that loose for you. That's into the hip. See that's right on the posterior side too. Bend this knee for me. Just try not to bend it all the way, or he'll kick me. Just up to there, okay?
Mm-hmm.
Usually I'm so used to guarding myself, but it's like right here. I can't quite get that. That is really deep in there. That is a huge contracture. Wow. Is anything going numb already?
I'm sorry?
Is anything going numb?
No.
Okay. Alright, let me think here. On your side facing me. Maybe there's some things I can do to make this shorter. Yeah, and then bend this knee. Like that. So let's elongate it maybe. Is that too much? You okay?
Great.
Okay, I got more leverage here. Okay, this might not be fun. I don't know, back off a little bit for me. Right there, just right there. Yep, you're good. He's very tough. I think one of the toughest people we've had on the legs in a while.
Trust me, I'm just not showing it.
Oh, no, you're not even flinching, though. You're not even, like, pulling away from me at all. I can't even get into that one.
Yeah, I'd probably be lying if I said I didn't like it.
I was gonna say, what's wrong with you? I'm just kidding. Alright, I'm gonna adjust it. It's pretty smooth. I'm just giving you a hard time. Pelvis towards me, but then your whole body goes back. Ooh. I did not expect that. You're full of surprises today.
Yeah.
Other side. Okay, head back, yes. Wow, stay there. That was your pelvis right here. I see that. Oh, there's a tiny one here, but not bad.
Yeah, this leg definitely doesn't hurt as much.
On your back for me again. That's it. Where is it? Quad.
Yeah, sometimes I'll even find myself sitting there just mashing my thumbs into my hip flexor on that side, just 'cause it'll just be tight and sore.
Right there. Wonder why it wants to over-contract so much. So what happens is it just gets in the way when you try to internally rotate. The muscle's in the way.
Oh.
It's like, no. And that usually means it's, posturally related, and like he said, maybe genetics. Does your dad have this problem? Does your mother have this problem?
No.
And it might not even be your mom. It might be like if your mom there has brothers.
Mm-hmm.
Because your mom might be okay,
Mm-hmm.
but then her brother will have it. Like I have a lot of things that my dad's sisters have.
Oh, yeah.
You know what? Just go to where it's painful, not any further. About there?
Yeah.
Okay. I mean, look how much more it moves. You can literally hug your knee and pull it to your chest. I know it hurts, but you can compress that.
Yeah. I will sit here at night going to bed. I'll sit here and try and stretch it.
Try to do this stuff.
Mm-hmm.
Yeah. You can also lengthen it by taking it back the other way.
Oh, right.
Do you understand? You'll see me doing this on the Instagram. But I'm like, it's important! I'm trying to extend this leg. Sometimes you gotta really sit on it like that. You know what I mean? I have so much flexibility. I'm trying to figure out a tight spot. Mine's all tight, like in here.
Mm-hmm.
But you're squishing it on one side, you understand?
Mm-hmm.
And going straight on the other side. This is called pigeon.
Mm-hmm.
You might be somewhere like this.
Yeah, that looks about right.
Okay, and then holding on to something. So you take a chair, you grab a chair, and you just slowly, or your couch, the side of your couch or something, and you just slowly extend that leg down. You should be eventually, in about a month of doing this, you should be able to go at least to here.
Okay.
You want to try it really quickly? Just because I don't. So let's see. I want you to extend that leg backwards first. And then that comes up and over. You can use the table to kind of support you so you don't collapse into it. Yep, and you're just going to go straight to the back. Yes. We're going to do the good side first. You have pretty good flexibility, but how bad is that to do that?
I feel the tightness go up.
So just, open up the chest. Open it up. Yep. That's it. You hold it for about a minute to 2 minutes. Okay, if you're cold, if you're in a cold room, if you're outside, you only have to do about 30 to 60 seconds. Yeah. Okay, now if you can, lean forward, take this heel, pull it that way. Yep. That'll give you an even bigger stretch. Yep. And then you kind of lean into this leg. I don't know how much we can lean.
I think that's it right there, yeah.
Okay, so that's it, it's whatever. All right, now switch legs for me. Yep, that's it. If you can, pull the heel up this way. I know, it's okay. I mean, I've got you pretty limber right now from working on your legs.
Oh, yeah.
All right, where do you feel it in the hip? Right there? Yeah, that's what I felt on the back of you. How do you pop the hip yourself?
Oh, I'll just sit here and open it.
Okay, so that's just a little bit of a...
And this side I just haven't done yet. This will be loud.
You can go ahead if it makes you feel better. Okay. All right,
it does. It feels relieving when I do it.
Yeah, it's all right.
Yeah.
It's okay. There you go. This side isn't as bad.
Yeah, you can tell.
Feeling okay?
Oh, yes.
Okay.
How's it looking?
Pretty gnarly. Like that word, gnarly. You want to take a picture of it for him, Linnea? Come on and sit up for me and face the table. Then the light red goes away like in 30 minutes.
Mm-hmm.
Like your cheeks are red from being done there, same idea. Okay. The dark purple, 4 to 7 days. Okay. I'm going to show him.
Oh, nice.
Yeah, you can look at it. You can zoom in, whatever you want to do.
Yeah, I can see all it coming up on that one part on the side.
Yeah, like all here.
Mm-hmm.
But down into the ribs. It'll be gone soon. And then you're gonna look up for me. Yeah. Oh, is that as far as we go? Oh, you can relax your head if you want. Just whatever feels comfortable.
Mm-hmm.
Do you feel it?
I feel it stretch.
Okay, then back down. Take a couple breaths. And again.
Mm-hmm.
Inhale, here we go. Up. Head back, look back. That's it. Okay. Elbow, push. You see how hard you have to like
Oh, yeah.
push? You got some thick joints. Yeah.
There it is.
You have to
Okay.
like, Good. That's it. That's it. Good. Lean away. I feel like you could have been a bodybuilder or something if you wanted, like a power lifter. You have like really thick
Yeah, probably.
articulations.
Yeah, I gotta get in the gym.
Like you just have the physicality for it.
Mm-hmm.
A lot of these bodybuilder guys, they have like these little tiny little, and I flick the wrist and it cracks. You have like nice,
Yeah.
like dense joints,
Thank you.
so it could handle that. Okay. Excellent. And breathe. Deep breath in. Oh yeah. There it is. Yay!
Yeah, I would never be able
You
to bend
can. If El Stifo over there
not
can
now,
do
yeah,
it.
today at
If
least.
Diego can do it, you can do it. All right. I'll stop preaching to you. All right. I think you did really well.
It was great.
Okay. Yeah. I mean, I don't know. I feel like I needed more weight on you. Maybe because I didn't make you scream or flinch enough.
Oh, yeah. I
He's
guess
not
I'm
saying anything. I'm not doing my job.
Oh, no. It's just a ruse to get you to think that you're not doing anything.
Oh, is that right? Is that right?